strange behaviors of adults who were, as children, abused and/or beaten by authoritarian abusive parents. The effects of childhood abuse and parental authoritarianism on adult behavior are profound and multifaceted. This study delves into the intricate dynamics surrounding the odd, bizarre, and strange behaviors exhibited by adults who endured abuse and/or were subjected to authoritarian parenting during their formative years. By exploring psychological theories, empirical research, and clinical insights, this paper aims to provide a comprehensive understanding of the complex interplay between childhood experiences and adult behaviors. Through a synthesis of literature and case studies, it becomes evident that the impacts of early trauma extend far beyond childhood, shaping cognitive, emotional, and interpersonal functioning in adulthood. Moreover, this study underscores the importance of therapeutic interventions and support systems in facilitating healing and promoting resilience among survivors of childhood abuse. Introduction. Childhood abuse, whether physical, emotional, or psychological, leaves an indelible mark on individuals that can persist into adulthood. When coupled with authoritarian parenting characterized by strict discipline and punitive measures, the consequences can manifest in a myriad of odd, bizarre, and strange behaviors in adulthood. Understanding the underlying mechanisms behind these behaviors is crucial for providing effective interventions and support to survivors. This study embarks on a journey to unravel the complexities of such behaviors, shedding light on the psychological, social, and biological factors at play. Theoretical framework. A. Attachment theory. Early experiences of abuse and neglect can disrupt the formation of secure attachments, leading to difficulties in establishing trusting relationships in adulthood. This insecurity may manifest in odd behaviors such as avoidance or ambivalence in interpersonal interactions. B. Trauma theory. Childhood abuse alters the neurobiological stress response, resulting in hypervigilance, emotional dysregulation, and dissociative tendencies. These symptoms may manifest as bizarre behaviors such as flashbacks, dissociative episodes, or exaggerated startled responses. C. Social learning theory. Children learn from observing and imitating their parents' behavior. Authoritarian parenting models aggression and control, which may be internalized and replicated in adult relationships, resulting in odd behaviors such as controlling or coercive tendencies. Empirical evidence. Numerous studies have documented the long-term effects of childhood abuse and authoritarian parenting on adult behavior. A. Research indicates that individuals who experience childhood abuse are at increased risk for developing psychiatric disorders such as depression, anxiety, and post-traumatic stress disorder (PTSD). B. Studies have also found correlations between childhood abuse and maladaptive coping strategies in adulthood, including substance abuse, self-harm, and disordered eating behaviors. C. Furthermore, there is evidence to suggest that survivors of childhood abuse are more likely to engage in risky sexual behaviors, experience difficulties in intimate relationships, and exhibit symptoms of personality disorders. D. Additionally, longitudinal studies have demonstrated the enduring impact of childhood abuse on physical health outcomes, including increased risk of chronic pain, cardiovascular disease, and autoimmune disorders in adulthood. Clinical insights. Drawing from clinical observations and case studies, mental health professionals offer valuable insights into the odd, bizarre, and strange behaviors commonly observed in adults who were abused or subjected to authoritarian parenting. A. Dissociative symptoms. Survivors of childhood abuse may experience dissociative symptoms such as depersonalization, derealization, or amnesia as a coping mechanism to detach from traumatic memories. B. Self-destructive behaviors. Some individuals engage in self-destructive behaviors such as substance abuse, reckless driving, or thrill-seeking activities as a way to numb emotional pain or regain a sense of control. C. Maladaptive coping strategies. Adults who were abused as children may resort to maladaptive coping strategies such as avoidance, denial, or dissociation when faced with stresses or triggers reminiscent of their traumatic past. D. Relationship patterns. Survivors of childhood abuse often struggle with intimacy and trust issues in adult relationships, oscillating between fear of abandonment and fear of engulfment. This ambivalence may manifest in odd behaviors such as push-pull dynamics or emotional volatility. Resilience and recovery. Despite the profound challenges posed by childhood abuse and authoritarian parenting, many survivors demonstrate remarkable resilience and capacity for recovery. A. Psychotherapy. Evidence-based therapies such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and eye movement desensitization and reprocessing, EMDR, have been shown to be effective in treating trauma-related symptoms and promoting healing. B. Social support. Strong social support networks consisting of family, friends, and community resources play a pivotal role in buffering the adverse effects of childhood trauma and facilitating recovery. C. Self-care practices. Engaging in self-care practices such as mindfulness, relaxation techniques, physical exercise, and creative expression can help survivors regulate their emotions, reduce stress, and cultivate a sense of empowerment. D. Advocacy and education. Increasing public awareness and advocacy efforts aimed at preventing child abuse, promoting trauma-informed care, and destigmatizing mental health issues are essential for creating supportive environments and fostering resilience in survivors. Conclusion. In conclusion, the odd, bizarre, and strange behaviors exhibited by adults who were abused or subjected to authoritarian parenting during childhood are a testament to the profound and enduring impact of early trauma. By illuminating the underlying mechanisms and exploring pathways to resilience and recovery, this study underscores the importance of compassionate understanding, evidence-based interventions, and supportive environments in promoting healing and fostering well-being among survivors of childhood abuse. Moving forward, continued research, advocacy, and collaboration are essential in addressing the complex needs of this vulnerable population and building a more compassionate and trauma-informed society. The exploration of odd, bizarre, and strange behaviors exhibited by adults who were abused or subjected to authoritarian parenting during childhood underscores the complexity and depth of the impact of early trauma. The theoretical frameworks of attachment theory, trauma theory, and social learning theory have provided valuable lenses through which to understand the mechanisms underlying these behaviors. Attachment disruptions, neurobiological alterations, and learned patterns of behavior contribute to the manifestation of odd and bizarre behaviors among survivors of childhood abuse. Furthermore, empirical evidence has corroborated the enduring impact of childhood trauma on mental and physical health outcomes, highlighting the urgent need for effective interventions and support systems. Clinical insights have offered valuable perspectives on the odd behaviors commonly observed in survivors of childhood abuse, including dissociative symptoms, self-destructive behaviors, maladaptive coping strategies, and relationship patterns. These behaviors serve as adaptive responses to the trauma experienced during childhood, reflecting attempts to navigate and cope with overwhelming emotions and experiences. Despite the profound challenges posed by childhood abuse and authoritarian parenting, many survivors demonstrate remarkable resilience and capacity for recovery. Psychotherapy, social support, self-care practices, and advocacy efforts play crucial roles in promoting healing and fostering well-being among survivors. By addressing the complex needs of this vulnerable population and building a more compassionate and trauma-informed society, we can work towards mitigating the long-term effects of childhood trauma and empowering survivors to lead fulfilling lives. Moving forward, continued research, advocacy, and collaboration are essential in creating a supportive environment for survivors of childhood abuse. By amplifying their voices, advocating for systemic change, and promoting trauma-informed care, we can work towards breaking the cycle of abuse and fostering a culture of empathy, understanding, and healing. In conclusion, while the odd, bizarre, and strange behaviors exhibited by survivors of childhood abuse may be challenging to understand, they serve as poignant reminders of the enduring impact of early trauma. By addressing the root causes of these behaviors and providing compassionate support and interventions, we can help survivors reclaim their agency, resilience, and dignity, paving the way for a brighter and more hopeful future. This study has shed light on the intricate interplay between childhood experiences and adult behaviors. Drawing from psychological theories, empirical research, and clinical insights, it is evident that the effects of childhood abuse and parental authoritarianism extend far beyond the formative years, shaping cognitive, emotional, and interpersonal functioning in adulthood.